Up next, we have Dr. Manish Singh. Dr. Singh received his Bachelor of Medicine and Master of Surgery from Netaji Subash Chandra Bose Medical College and Hospital in Jabalpur, India. Dr. Singh completed his residency in surgical gastroenterology at Bhopal Memorial Hospital and Research Center in Bhopal, India. He then completed his residency in general surgery at St. Agnes Hospital in Baltimore, Maryland, and trained in advanced laparoscopy and bariatrics, having conducted his fellowship and weight loss surgery at Cleveland's Clinic Bariatric and Metabolic Institute in Cleveland, Ohio. Dr. Singh serves as our CEO here at DHR Health, and he serves as the medical director at the DHR Health Bariatric and Metabolic Institute. Welcome, Dr. Singh.
Good afternoon, everybody. Well, it's good. It's a very energetic crowd. And I see a few neurosurgeons down here. So it may take a long time. What was the question? How long does it take to become a neurosurgeon? Not long enough. We need you. That's a good question. So if you are thinking, do it. So I'm glad. Thanks for being here. And I thank you. Thanks, Dr. Rao, the DHR Health Research Institute, everybody who's involved, including Region 1, for having this conference. And I'm going to talk a little bit from the DHR side perspective why we are doing this. We all saw in last 2 years what we have been dealing with our, as when we think about pandemic. That's the healthcare crisis which comes to our mind right away. But you heard today there are other healthcare crises in the community that is going on, including cancer, obesity, diabetes, fatty liver disease, and all those things. So why is it important for me personally? Why is it important for Dr. Rao? Why is it important for DHR Health to have a meeting or conference like this? Because that's our vision. And I would like to read the vision of DHR Health to you for you to understand why we are gathered here. So the vision for DHR Health is to create a world-class health system to advance medicine and increase access to the communities we serve by empowering caregivers like you guys to heal through compassion, knowledge, innovation, integrated care, and excellence. That's our vision. That's the vision for DHR Health. And this series, what you are seeing, is part of that. Public health crisis is not something we need to try to treat or take care of that when it explodes in front of us. The only way to treat or take care of any of those crises is by research. Especially in pandemic, you saw all this. Even today, who heard today the US government is going to buy billions of dollars worth of those pills so that hospitalization doesn't happen with COVID patients. That's a new thing. Every day you hear something that's coming new. And we are way far away from Washington, D.C. That doesn't mean we should be being in the last in the line to get what is available as far as research is concerned. We should be the first one. Not only we should be the first one, as if you go by Dr. Rao, we should be the one who should be innovating that. You should be the part of that, those people, that community that innovates those things and gives it to the rest of the world. And that comes from research and innovation. I don't know whether it was mentioned today or not, that the participation of our community, the Hispanic community, in all these research which is going on is minuscule. It's not there. And lot of studies and drugs and medicines that are being given to people are not tested on people which is predominantly here. And so we don't know whether it's going to work or not. All those things you read today, they are being researched somewhere else. And we are trying to implement them here. That's a problem. That's a big problem for the community. That's not innovation for our community. The real innovation for our community, if we have the research down here in the valley, for our people, by the people, and for rest of the country and rest of the world. So it is very important for each one of you when you go home today. Look in the mirror. What can you do for this community from today? And why is that important? Because Martin Luther King had said, the right time to do the right thing is right now. So what can you do to make sure this innovation starts here in the community today? Find out people who are out there. Find out people who can participate in these research processes. DHR Health Region 1, we have this process here, thankfully. We have developed that and we are still developing. but we need people to be part of the research so that we can research on our people and we can find the right treatment for right diseases for our people. So this is the thought I would like you to go home with and think about it and start working on it today. Other than that, thank you for being here. I know it was a long day. We have another session, I think next year, and we'll have more of that. And I look forward to seeing all of you guys here. Thank you. Thank you for being here.